If you have trouble with procrastination, focused attention, completing tasks, anxiety, or disorganization, you may be one of the estimated 8 to 9 million adults with ADHD, and you might not even know it. Keep watching to learn how testing and treating zinc deficiency can help you manage your symptoms and get your brain back. I've helped hundreds of women with their mental health in my career as a functional medicine doctor. But recently, I've noticed an uptick in adult women who are being diagnosed with ADHD. This isn't necessarily a bad thing. Many of these women find a great sense of relief in finally knowing the reason for their struggles, in both their personal life and their professional life. They can also come to understand why things that seem easy for other people are hard for them. These women often find that they can also view their childhood struggles with more compassion and understanding as well. And many are working through their emotions in therapy. And all of this is good news. But what many of them aren't told is that ADHD is as much a physical problem as it is a mental and emotional one. ADHD is a neurobiological disorder involving dysfunctional neurotransmitter regulation and metabolism in the brain. And it's associated with a host of other very real physiologic imbalances, deficiencies, and dysfunctions. This means that you can treat it with physical medicine, and I don't just mean stimulant drugs. And it's important that you do, because if ADHD is left undiagnosed and untreated, the consequences can be severe. When researchers compared women with ADHD to women without ADHD, they discovered that the women with ADHD had double the prevalence of substance abuse, smoking, depression, and poverty. They also had triple the prevalence of insomnia, chronic pain, suicidal thoughts, and generalized anxiety disorder compared to women without ADHD. Women and girls with ADHD are often misdiagnosed and treated for anxiety instead, because they tend to have the inattentive symptoms of ADHD without the hyperactive or disruptive symptoms typically seen in boys. The point is that, despite how it might feel, ADHD is not a condition of low intelligence, poor character, lack of willpower, or personal failure. It's a very real, very physical brain disorder that can and should be addressed on a physiologic level. But conventional medicine treatment options are limited and can have some pretty serious side effects. This leads many folks to seek out complementary and alternative options for relieving ADHD symptoms. Perhaps that's why you're watching right now. If so, you're in the right place, because in this video, I'm going to show you how optimizing just one micronutrient can help relieve ADHD symptoms, support better brain function, and even prevent other health issues. And that micronutrient is zinc. And just a quick note, even though this video focuses on women, these strategies can help everyone with ADHD, adults and kids and people of all genders. In general, ADHD folks tend to be deficient in zinc, iron, vitamin D, and magnesium. And we're talking specifically about zinc today, but I'm planning to make videos about these other micronutrients as well. So be sure to check my channel's library for those. Not only does zinc help your body make crucial neurotransmitters, including dopamine, norepinephrine, and serotonin, but it also helps nourish and support the neurons in your brain. The production of melatonin also relies on adequate zinc levels, which is important because low levels of melatonin can lead to sleep problems, which exacerbate the symptoms and mental fatigue of ADHD. Zinc also protects your brain from inflammatory damage and helps control the hippocampus, a part of the brain's limbic system that helps with learning, memory, and emotions. Zinc helps protect your body from accumulating heavy metals, which is important because heavy metal toxicity is one of the root causes of ADHD symptoms and brain dysregulation in the first place. Here's one quick example of how this can happen in real life related to the foods you choose to eat. Yellow number 5 is a common food additive found in things like candy, soft drinks, chips, popcorn, and cereals. You'll find it in Sunny D orange juice, Starburst candies, Gatorade, tortilla chips, and even certain brands of pickles. Well, yellow number 5 is known to decrease healthy zinc levels in the body. Suboptimal zinc levels make it harder for your liver to detox and clear out heavy metals like mercury, lead, cadmium, and arsenic, which can then accumulate in your tissues and disrupt brain function, leading to ADHD symptoms. This is just one of the reasons that artificial food additives worsen ADHD in many people. One study found that 73% of children with ADHD showed a decrease in symptoms when artificial food dyes and preservatives were eliminated from their diet. But it's not just about having optimal levels of zinc. You also need to take into account the ability of zinc to be used by the body, as well as your ratio of zinc to copper. Chronic stress negatively impacts your zinc status because chronic stress can raise cortisol levels, and cortisol blocks the activity of zinc. This can lead to a vicious cycle of stress from ADHD symptoms, causing lowered zinc activity, which then leads to worse ADHD symptoms. BPA, or bisphenol A, an endocrine disrupting chemical found in many plastics, is a zinc binding and zinc blocking chemical. So even if you're consuming enough zinc in your diet or taking a zinc supplement, if you're drinking from plastic water bottles or heating your food and beverage in plastic containers, you could be undoing all of that good effort. Let's talk about copper. Unlike zinc, copper is easy for most people to get in their diet because copper is found in foods like potatoes, chocolate, cashews, and chickpeas. In the United States, we're also exposed to copper in our water because of the copper pipes that are commonly used in our plumbing. Copper is toxic to the brain in high amounts, especially when it's not balanced by zinc. Too much copper blocks the production of serotonin, which can cause emotional, mental, and behavioral problems. It can also increase dopamine when it's not balanced with zinc. Interestingly, the metabolic demands of starting puberty can burn through zinc stores, sometimes causing copper excess. This could be one of the reasons that ADHD symptoms can become more problematic during this phase of life. So, now that you know how important it is for folks with ADHD to have optimal zinc levels, particularly active, unbound zinc that's balanced with copper, how can you apply this knowledge to your situation? Well, first of all, it's important to make sure you're consuming enough zinc. Unfortunately, zinc is really hard to get in your diet unless you're a big fan of oysters, which have awesome levels of zinc. Even other meat sources are pretty low per serving, and if you don't eat much meat, it's even harder to maintain optimal levels of zinc. Some whole foods that have small amounts of zinc include beef sirloin, blue crab, oats, pumpkin seeds, pork loin, lentils, and Greek yogurt. But you need to realize that a cup of oats only gets you 21% of your needed zinc, and half a cup of lentils only gets you to 12% of your daily requirement. So like I said, it can be super tricky to get enough zinc from food sources alone. It's worth noting that zinc is also lost through sweat and high-intensity exercise. And since many folks with ADHD use exercise to help manage symptoms, it can be even harder to maintain optimal levels. Zinc is one of the most commonly depleted micronutrients that I see on testing. Thankfully, you can measure your levels using a special blood test called RBC Zinc. RBC stands for red blood cell, and it measures your body's zinc levels over the life cycle of a red blood cell, approximately 120 days. This test is much more helpful than a plain serum zinc test because you get a more accurate idea of long-standing zinc levels. If you have an ADHD diagnosis or suspect that you may have ADHD, it's a good idea to test your RBC zinc levels. And if your doctor's unfamiliar with this blood test or unwilling to order it, you may even be able to order your own test through my website. I'll put more information about this opportunity in my zinc boosting checklist, which you can download for free at the link in the video description. If you do find that your zinc levels are suboptimal, increasing your dietary intake and supplementing with zinc can be a game changer for improving your ADHD symptoms. For reference, I like to see RBC zinc in the 1300 to 1470 range. Research shows that not only do low zinc levels set the stage for ADHD symptoms, but the lower your levels, the more severe your symptoms are likely to be. A study of 118 children with ADHD found that those with the lowest blood levels of zinc had the highest levels of inattention, distractibility, hyperactivity, impulsivity, and anxiety. It's important to note that it takes 3 to 4 months for zinc supplementation to restore a normal copper balance, but you'll likely see incremental improvement before that. I'll share my favorite enhanced absorption zinc supplements in the checklist too, as well as suggested dosing for adults and kids, just in case that's helpful. Here's some good news. There are many evidence-based functional medicine treatment strategies that get to the root of ADHD symptoms, besides zinc optimization. So be sure to like and subscribe to my channel. There are more videos in the works. If you don't want to wait, or you'd like the convenience of all of these ADHD strategies in one place, check out my Adult ADHD Deep Dive. It's a comprehensive, in-depth video resource with tons more research and actionable strategies that you can use to treat your ADHD symptoms using functional medicine. You'll find info about the deep dive in the video description, along with a link to the free zinc boosting checklist. Thanks so much for watching. I'll see you over in the next video.